Hello everyone, I am Dr. Govind Desai, Senior Resident from the Department of Pulmonary Medicine, AIMS Jodhpur. So today I am here to discuss about the COVID vaccines which are available in India. So as we all know, on 16 January 2021, India started the vaccination program. So right now at the given moment, we have two vaccines available at our disposal, the Covaxin and the Covishield. So Covaxin is the vaccine which is being produced by Bharat Biotech, which is based in Hyderabad. And we have Covishield, which is a vaccine produced by the Serum Institute of India under the licensing of Oxford AstraZeneca company. So both these vaccines are targeted against the corona infection. So both these Covaxin and Covishield vaccine are given in two doses. The first dose is given on day 1, following which 4 weeks later or 28 days later, the second dose of Covishield or Covaxin is to be taken. The vaccines are given intramuscularly. So the route of administration here is basically through the deltoid muscle here, which is a muscle wherein the injection has been given to us. So this is a 0.5 ml injection given intramuscular. So as we know, two doses are required for effective COVID vaccination, be it Covishield or Covaxin. Let us see who are allowed to take the vaccine and who are not allowed to take the vaccination. So according to the Ministry of Health and Family Welfare, any person above the age of 18 years is allowed to take the vaccine. But there are certain contraindications which have to be remembered. Number 1 is a pregnant female. Any female currently pregnant cannot take this vaccination. Second, a lactating mother, that is anyone who is breastfeeding her child, is not allowed to take the vaccination. Third, anaphylaxis. So what is anaphylaxis? Anaphylaxis is basically severe allergic reaction to any sort of previous vaccination, previous injectable therapies, food or anything. So when I say anaphylaxis, it means the patient would have had a history of severe allergy. Now this could be swelling up of the lips, sometimes difficulty in breathing, and sometimes severe rashes all over the body. These are the three main contraindications which have to be remembered. Other than this, any patient who was COVID positive and is in the recovery phase, that is up to around 6 to 8 weeks post COVID infection, vaccination should be deferred. Second, who is presently having any kind of active illness, the vaccination can be delayed. Third, any patient who during the case of COVID infection has received convalescent plasma therapy should avoid COVID vaccination. And fourth, which is most important, any patient with presently COVID-19 infection should not take this vaccination. So once you're vaccinated, maybe for a day or two, you might experience minor side effects. So these side effects can be most commonly pain at the site of the injection, tenderness at the site of the injection, headache, fever, and body ache. And for all of these side effects, paracetamol can be taken. So right now in India, phase 1 vaccination is going on, wherein doctors, nursing staff, and other healthcare professionals are being vaccinated. In the stage 2, the elderly population and those with comorbidities, that is, patients with hypertension, diabetes, kidney diseases, and heart diseases, will be vaccinated. And in the phase 3, the general population will be vaccinated. So the question arises of which vaccination has to be taken, whether Covaxin is better or whether Covishield is better. Coming now to Covishield and Covaxin, how are they different? So in Covishield vaccine, basically it is following a vector-based technology wherein a part of the COVID virus protein is injected in another virus, that is an adenovirus, which is used as a vehicle for this COVID protein and is being injected to our body. So once it enters inside our body, it mounts an immune response which helps us to provide antibodies which will further prevent COVID infections, or whenever next time a COVID infection happens to us, it will be asymptomatic or it might be mild. In a case of covaxin, the dead genetic material of the coronavirus is injected inside us, and the further process is very similar to how a Covishield vaccine does to our body. So both are equally efficacious. It's just that the mechanism of vaccination is different in these both vaccines. So my take home message to all of you would be to take this vaccination whenever it's your turn. It's a wonderful vaccine, and hoping that this pandemic comes to an end very soon. Happy vaccination. Stay safe, stay healthy.